Good morning. Welcome back to Channel 10. Thank you for joining us today for our weekly episode of Diseases and Disorders. Today we will be discussing multiple sclerosis, commonly known as MS. First up, we have Kate with the basic pathophysiology and etiology.
Thanks, Anna. First, let's start off by looking at a healthy nerve in a normal person's body. So in a healthy person, the nerve has a cell body which have dendrites on one end, connecting down to a long axon, and then the axon terminals at the end. So the nerve signal is going to be transmitted. It's received at these dendrites through the cell body, down through the axon, and is transmitted to the next nerve through the axon terminals. So with the myelin sheaths, these serve kind of like with an electrical cord to insulate the nerve and prevent the signal from being disrupted or displaced as it travels from the cell body down to the next nerve. So with multiple sclerosis, there's several cells involved. You're going to see the B cells moving through the blood-brain barrier. They're going to activate plasma cells here, which then release antibodies that attach to the nerve itself all the way down. Those antibodies are going to serve as a trigger point for macrophages, which are then activated to destroy the nerve and the myelin sheath. Another cell we're going to see involved here are going to be the T cells. They're going to be activated into these autoreactive CD8 T cells. These go through the blood-brain barrier and stimulate an inflammatory response through releasing cytokines, which cause inflammation in the central nervous system. They're also going to attack the oligodendrocytes, which are responsible for producing the myelin that protects the nerve. And like I said, they're going to activate these macrophages, which are cells that eat up anything that's been tagged by an antibody or that needs to be destroyed. So these macrophages are going to come in and eat up all of the myelin along that nerve. So just to recap, let's take a quick look at some of the differences between a healthy nerve and a nerve that's been affected by multiple sclerosis. So as we talked about, the myelin sheath on this healthy nerve here is intact. It's insulating that nerve all the way down so that the nerve signal can't be disrupted. But then with multiple sclerosis, the myelin has been attacked by those immune cells so that the nerve is actually exposed to the rest of the central nervous system. The etiology of this disease is relatively unknown, but it's thought to be an autoimmune condition or an immune-mediated condition because of the B and T immune cells that are responsible for the destruction of the nerves and the myelin sheaths. But overall, the etiology is not completely determined. Back to you, Anna.
Thank you, Kate, for that informative segment. Remember, nurses, it's always important to know the pathophysiology of a disease to ensure excellent patient care. Oh, and now we have a breaking public service announcement. We'll be right back.
This is an important public service announcement brought to you by Channel 10. If you or a loved one are experiencing numbness or weakness in a limb, tremors, lack of coordination, an unsteady gait, partial or complete loss of vision, fatigue, and dizziness, you might be suffering from undiagnosed multiple sclerosis. Those at most risk for developing multiple sclerosis are women between the ages of 20 and 40, those who have a family history of multiple sclerosis, and those who do not get enough vitamin D or sunlight, those who smoke, who are obese, or who suffer from other autoimmune diseases such as pernicious anemia, psoriasis, type 1 diabetes, thyroid disease, and inflammatory bowel disease are also at a higher risk of developing multiple sclerosis. If you or someone you know are in one of these at-risk populations and are experiencing a sudden onset of neurological symptoms, schedule a visit with your doctor today to discuss the possibility of being diagnosed with multiple sclerosis. For a definite diagnosis, your physician may order a blood test to check for biomarkers of multiple sclerosis. They may perform a spinal tap to analyze spinal fluid for abnormal antibodies, and they may order an MRI to look for lesions on your brain and spinal cord that may be consistent with multiple sclerosis. Talk to your doctor today if you have any concerns. Diagnosing multiple sclerosis as soon as symptoms begin can help you maintain and improve your quality of life by beginning treatment right away.
Have you tried every other treatment for multiple sclerosis with no relief of your symptoms? My name is Ashley Wertenberger, and I'm here to tell you about an alternate solution for your MS manifestations. Plasma replacement therapy is a treatment plan for autoimmune diseases that takes out some of the antibodies that cause tissue damage and pain. The process is very simple. We have a model right over here to demonstrate. First, blood is removed from a vein. This process is very similar to any other kind of blood transfusion or blood donation. And once the blood is removed, the red and white blood cells are separated from the plasma cells. The plasma cells are where the antibodies are located. Plasma cells are removed, and the red and white blood cells are mixed with a protein solution that has extra albumin, and the red and white blood cells protein and plasma solution is put back into the body. Plasma replacement therapy can be the solution to your untreatable MS symptoms. Ask a doctor today if plasma therapy is right for you. Thank you.
Thank you for that PSA Channel 10. Today we have the privilege of speaking with Elizabeth Ferguson. She and her husband live in Fredericksburg, Texas, and have 7 children with number 8 on the way. And today she will be speaking with us about the effects of multiple sclerosis on her life.
Over about 6 months, I had a really tight succession of symptoms. So after the optic neuritis, I had some muscle spasms in my arms. I noticed a lot when I was playing piano and lost some control of my hands. Mm-hmm. And then for about 6 weeks, I lost a lot of feeling in my legs. Okay. And that was a huge problem. After the obvious and really awkward symptoms went away, like vision problems and losing feeling, right, the more subtle symptoms were things like major fatigue. Mm-hmm. So like I went from having a pretty active day-to-day life to having like, say, one day of being totally under the weather or just wiped out. Yeah. And then two good days. So one really bad day, no energy, and then say maybe 2 good days. After the first year, I noticed a whole lot of memory loss, like short-term memory loss. Okay. And it's a very well-known problem. I needed to learn how to say things like, I'm at the end of my rope, or I'm at the end of my day. I can't really do a whole lot anymore. I need to be off work. Mm-hmm. And so as a stay-at-home mom, I was basically saying, okay, I'm at the end of my rope, and that helped me be able to draw a line and say, okay, I need to sit down, and I don't need to feel guilty about it. Yeah. That's helped a lot, just communicating with the family so that they're not asking more or not frustrated, and so that I can have the peace of mind to just draw a line in the sand. I did meet with a fetal maternal specialist. Both of the specialists that I spoke to said that they see very little conflict between MS and pregnancy. Some of the just the fatigue and some of the symptoms like joint pain or whatever, that would be felt whether or not you have MS. Right. Yeah. So they said a lot of the literature says that pregnancy almost masks MS symptoms. Okay. But they just don't see a lot of conflict there. They do tell mothers to expect some sort of flare-up. Mm-hmm. after the babies are born. So postpartum flare-ups are really common.
Thank you for speaking with us today, Mrs. Ferguson. It's always important for us as nurses to know how diseases affect the daily lives of our patients. Next up, we're going to have Ashley with Good News of the Week after a quick word from one of our sponsors.
When I was first diagnosed with multiple sclerosis, I had a really difficult time managing my symptoms. I had to deal with a lot of remissions and exacerbations, and nothing seemed to be helping. But that's when I found Avonex. Avonex is a revolutionary new drug. It's an intramuscular injection just once a week, and it helps slow the progression of the disease and reduce the frequency of remissions.
Do not take this drug if you have a history of hypersensitivity to natural or recombinant interferon beta, or if you have a history of hypersensitivity to albumin. The most common side effects experienced are flu-like symptoms such as fever, chills, muscle aches, and fatigue. Adverse effects such as liver damage, anaphylaxis, congestive heart failure, seizures, depression, suicidal thoughts, and psychosis can occur. Contact your doctor immediately if you experience any symptoms of depression, suicidal ideation, or psychosis.
Join the more than 500,000 people worldwide who are fighting MS remissions and ask your doctor about Avonex today.
Ashley Wernberger here, and I'm reporting on our Good News of the Week. Today we're going to be looking at the story of a remarkable young woman and athlete with multiple sclerosis who made headlines across the nation. It was even featured on an ESPN special, Catching Kayla. Kayla Montgomery was a normal high schooler when she suffered a debilitating spinal cord injury while playing soccer. This injury led to the formation of lesions and plaques on her spinal cord and the development of multiple sclerosis. A rising star track athlete, Kayla persevered through her diagnosis to become even faster despite the impacts of MS on her body. Manifestations of MS caused her neurons to misfire, causing her to completely lose feeling in her legs as she ran, so that once she began running, she was not able to stop. At the end of each race, Kayla had to be caught by her coach and immediately submerged her legs in cold water to recover. Amazingly, Kayla's times on the track continued to improve and led her to sign on to Division I track team at Liscombe University. Kayla's story serves as a beacon of hope to those with difficult diagnoses and disabilities, and to all athletes that much can be overcome with perseverance and courage. Thanks so much for joining me for Good News of the Week.
Thank you, Ashley. Unfortunately, we are out of time, but thank you for joining us for our weekly episode of Diseases and Disorders. My name's Anna O'Leary, your host, and until next time, cheers.